At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live.
Hello and welcome. Happy New Year, everyone. I'm Donna Cryer. I am your host for GLI Live. I am so excited to welcome you all back. 2022 will hold no end of surprises, I'm sure. So to be thoughtful and mindful about how we enter the year, I thought it'd be a great idea to start at the beginning. And so my guest for this first episode of the year 2022, doesn't that sound like some type of futuristic Buck Rogers type of like Unreal year? It does to me. My guest is Ekaterina Katy Smali. I could spend the whole episode just reading all the letters after her name. But Katy is project manager for care management at Montefiore Medical Center in New York. But the title I'm sure she holds dearest and nearest to her is the very first intern for the Global Liver Institute. Welcome, Katy.
Thank you so much, Donna. I'm really excited to be here. Thank you for having me. It's good to be back on GLI's turf.
I know. And thank you for taking time out of your globetrotting and all of the fantastic things that you have going on to make this time for us today. A couple of things that reasons behind wanting to do this episode, besides just having an excuse to catch up with you, is that one, I wanted people to understand that GLI has always been a global organization, and we'll get into your background as part of that, and that internships and growing and nurturing talent is really core to what we do. As much as our mission is about the patients and families that we serve, GLI as a nonprofit organization is also an important place where we serve and grow and help young talent. And nothing gives me greater joy than to see you all succeed throughout the healthcare ecosystem. So Katy, why don't you just maybe tell the story of how we met?
Sure. So the way that we met was actually through a social networking platform, LinkedIn, if you do remember. I sent you a message. So as a young, master's student at NYU, I was just beginning my studies, and I knew that I wanted to think about internships early, because internships at their core, they give you the practical skills, you begin to network, and you really understand who are the key players in the field that you're trying to enter when you do graduate. So what I did as my strategy was I looked through LinkedIn and I looked at many different profiles. And I had a set of, my must-haves for an internship. First of all, I knew that I didn't want it to be a cookie cutter internship. So I already wanted to start with the leadership rather than the role, because you can always create a type of role if you have the enthusiasm and you know what type of learning or outcome you want to get out of that opportunity. So looking through a lot of profiles, Donna, your profile just hit me because I thought this is everything that I want to get out of a learning experience. I wanted to learn from someone who had patient experience. The reason why I went to NYU was I truly believe that in order to be a health policy leader, you need to start with the individuals that have firsthand experience. And those are the ones entering the system, individuals with chronic illness, multiple disorders. They really know what's going on. And I think we often overlook their experience and just assume that education knows best. So when I saw that, Donna, you had both your personal life experience with liver disease, and then you were championing through your work at that time, you were consulting with Cryer Consulting. And I saw some videos of you, and I thought that your personality just was shining star, someone that I thought would give me an opportunity to learn how to present well, how to grow my curiosity by reaching out to different platforms. And after reaching out to you through LinkedIn, we had a call, and it just really solidified my interest in working with you because you were a force of an individual. You're also a woman, and I really wanted to be mentored by a fellow woman that was working in the field. And I appreciated that I was studying at that time, doing a dual master's in public health and administration, but you were coming in with a law degree. And I thought, well, this is great. Now I get to also get my own little mini JD learning from you. So once we had that first connection, I reached back out with a proposal saying, I do get an opportunity for an internship. This is what I would like to learn. And it seems like, what you're doing fits with that mold. Here are some ideas of how I can help you. And I guess that worked because you were at the time starting to think about GLI and forming the organization. And I guess both of our enthusiasm melded well to do that together. And I really, to this day, am so grateful because I learned so much about, starting a nonprofit, advocacy, and of course, listening to the patient voice and putting that in the center of any policy work that I do currently. So I thank you for that opportunity.
Well, Katy, I really appreciated your your courageousness, your drive, your thoughtfulness in reaching out, but reaching out with a plan, reaching out with, what you wanted to accomplish. And, I was running a consulting firm at the time, Cryer Health, Patient-Centric Solutions. And so we created one of the first, patient-centered health care internships. And as we were doing that very early work in patient engagement and patient centricity for a host of entities across, biotech, pharma devices, and from the first chief patient officer to the early patient advisory boards and so many things that we see now, we were inventing those, and you were very much a part of that. And it's so exciting to see how you've carried that work forward. But then I sort of I switched things up for you, and I said, hey, do you want to help me create a nonprofit organization? Can we change your internship to do that? And you rewarded my openness and flexibility with some openness and flexibility of your own. And so really in the full credits of the founding of GLI, your name belongs there along with Dr. Hillel Tobias, because it was you and I, let's look at best practices in creating a nonprofit organization. I remember that assignment. And down through creating the first, our initial 501c3, and then you recruited our early staff as well. You turned around and tapped one of your friends to do our first social media and website. And so what was it like, being in the uppiest of startups?
Well, I think you sparked my interest in startup work. You have to really be someone that is okay with changing gears real quickly. Every day is going to be a different type of request. So I I personally knew that that's the type of way that I enjoy working. I like that kind of new and engaging environment. So for me, it was a really smooth transition. And I found the challenges to be more educational than frustrating. I took them on with a positive mindset. I think I walked away not being intimidated by doing something like a 501c application. I saw that, this is just part of the course of any large institution establishing themselves. They need to know what are their goals, what's the mission, and understanding that core drive of any organization I think is really important for a young professional, because then for yourself, what are my personal mission and values when I do enter the career world. So I think it really prepared me to answer those questions for myself as I helped you go through it for GLI. And I do think that it was a great opportunity also from an advocacy standpoint to start showcasing, we're a new organization, newly branded. How do we connect with what is already existing out there? And I thought it was a really great opportunity for myself to begin to do different types of projects like SWOT analysis, or looking at, what's out there in the international field for our global liver work. And it gave me an opportunity to learn how to connect and network with those institutions and align our visions to work together, because we don't just want to be a siloed approach when we're trying to advocate. So I think that for me personally, it was a really good challenge. And I think any young professional should consider, helping someone from the ground up establish a new vision, because you will learn a lot and it's exciting work.
You met every challenge that we faced together with that really great attitude and that approach of we're just going to figure it out and make it happen. And that's really I feel still essential to the core DNA of GLI today.
And I think with COVID, it's just we've realized that you need to know how to respond in the time of uncertainty. Right. So it creates that, comfort in this time that's unknown. And I think having those early experiences working within the organization, you're better prepared to have those skills in your personal toolbox on how to deal with that.
One of the things that I think was so helpful was the fact that you weren't born in the United States. So we had some paperwork and and issues and things to fill out as well. But I was undaunted by that. And I really valued the fact that you had that international experience and perspective from the very beginning. So tell us a little bit about, just you and your life and how you came to working for a DC organization and now in New York.
Absolutely. So going way back, I was born in Russia, so I had an immigrant experience coming to Canada. And as a Canadian, I knew early on that I was interested in global health. It's something that I felt really connected to, seeing how my family had to, navigate the healthcare system, and looking at how other communities like Aboriginal communities had to do the same with even more barriers and challenges. So early on in my career, when I was an undergraduate student, I created my own project to go to Nunavut in the Canadian Arctic and learn how the healthcare system there is functioning and what are their barriers to care. And that's kind of where my patient engagement interest led, because I just met so many elders who were very wise to what their community needed, but were always overlooked. And for me, being able to interview patients, I interviewed I'd say about 60 individuals within a community on how they interact with their healthcare system. That's when my eyes were opened to the importance of working globally and listening to communities' needs to better deliver care. That took me into the world of global health. So I've worked internationally from the Arctic to Cameroon, Africa. I've done work with the UN there. I worked with some Russian organizations. So once I joined Global Liver Institute, I knew it was the right place for me, because I came as a Canadian having free healthcare to the United States, where it's a whole different health system, and then understanding liver health and how that is also complicated as a chronic disease globally, and the network that, you can learn from each other how to manage your conditions and how to access medications and just to share stories is so important. And I really appreciated that I was given the opportunity to listen and to learn. And I took that time to do that. And coming to the US for me has been a really exciting opportunity. And I've been very grateful for all of those individuals who have been supporting my integration and my immigration over to the US. So I am a person of the world, and I love to work with it.
I remember speaking to the NYU Business School class and just looking incredulously as I was explaining the American healthcare system. And they're like, that makes no sense. I'm like, it doesn't. I'm just telling you how it is. I'm not saying it makes sense. I'm not saying it's right. I'm just explaining what it is. But understanding different healthcare systems and not being locked into, what this is or what has to be, I think is incredibly freeing and allows you to be very creative and really, focus on setting the standards of how healthcare should be rather than being anchored in how it has been done.
I completely agree.
So tell us what you're doing now, how you've taken all of that creativity and global experience and applied it at Montefiore.
Absolutely. I'm very fortunate to be working at Montefiore. I've been there for about 5 years, and I've been working primarily on one area of focus with my department. And so what I do is I work on integrated care. And what that really means from our perspective in our publication work is we look at how to integrate or bring in behavioral health services into primary care settings, and vice versa, primary care services or general health services into behavioral health settings. We truly believe that, whole person care is the future, and it's going to be a driver for reducing costs and improving outcomes for patients, because we're seeing more and more patients with, multiple chronic conditions, multiple comorbidities, and we need to tackle people from the mind to the body. And that's what we're doing. And, it's a big shift scope and thinking for practitioners, because a lot of practitioners are used to working clinically in their own area, but now we're shifting gears and saying, how can we work together as well as bringing in the patient voice into that conversation.
Even the health record has been, siloed, where, mental health or behavioral health records were kept apart by law from the physical health records. And so it was almost impossible for providers to put together a full picture of their patient, because the records were kept siloed. So even those of good intent had a very hard time, doing that. So do you think that? Let me ask the question. Yeah. What changes have sort of made your work possible?
Absolutely. So I think there's a few changes. One of them is the openness of providers to change. It's really hard, especially in a burnt out environment, but now to understand, how can we communicate with each other better, establishing more agreements between different types of providers and how they communicate. And that includes electronic health records. How are we going to send reminders or make sure that a patient came into their appointment, and you get those follow-up back to the other providers. So right. Those changes and, EHR systems opening up and breaking the glass between providers, that allows them to do that more seamlessly. But it definitely takes time to get to that point where they can work with their vendors and work with their partners to establish these new systems. I think virtual care is a huge change, and within the COVID pandemic environment, we're seeing that change being pushed even more quickly, which in some ways can be difficult for providers because laws are changing. But from a clinician, from a client's perspective, it's a great opportunity for, if you can't come into the clinic, you're able to have that virtual session. And if that helps you to protect yourself from, exposing yourself to COVID or from a mobility issue, it really does help alleviate the pressure on the system and the individual. So I think we're going to see virtual healthcare expand further, and it's going to be a system change that stays.
It's certainly one of GLI's top policy issues to ensure that neither CMS reimbursement nor state licensing issues stand in the way of it persisting. Post, if we ever get into a post-pandemic period, but allowing it to continue. And I think you touched on, and I just want to reinforce the advantages from both sides. So if you're a patient, if you're a patient, so if you're sick, if just getting out of the house to a doctor's appointment physically is a burden for you or your caregiver, or sort of all you can do in the day. I have personally experienced and certainly talked to people multiple times a day where, a shower is a stretch goal. So getting out to a doctor's office, that just may be beyond what people can do. But then from the behavioral health side, if you are, depressed or, just the, from a mental health issue, getting out to and making your way, across how many, miles or what, types of transportation, issues, whether during a pandemic or not, getting yourself up and out from, an energy perspective, a mental health perspective, to a provider, maybe more than people can do. And so whether accessing help, with telephone visits or video visits, both have value and both have some patient preferences around them, from either side, let alone if you're experiencing both together, bringing care to people rather than forcing people to have to go to care and then, dinging them as, non-compliant when they can't overcome all of those barriers, I really think is an advance.
Absolutely. And, we're both from large cities, but many of our patients live in remote areas, and this can really help alleviate some of their pressures of being able to get to a good practitioner to get them even a diagnosis they need. So there's a lot of opportunity here to expand medicine into those hard to reach corners.
New York is, of course, a very multicultural city. There are a lot of languages that are spoken and a lot of different cultures that people come to. And so how do you help, bridge those gaps within the healthcare system so that everyone can have access to the type of integrated programming that you're putting together?
Absolutely. That is something we think about constantly because of the language barrier and the cultural barriers, making sure that patient education and self-management tools are adapted in multiple languages. Having translators available is very important for our communities, as well as understanding how do we train clinicians to be more informed on traumas and how to deal with trauma in our community. How to train our clinicians to ask questions that are more culturally sensitive and appropriate. And having an equity lens is really important. At Montefiore, we're always promoting thinking about equity and race and all of these issues that we've been hearing come up lately. We want to make sure that they're not lost in the way that we deliver care, and that everybody in our community is feeling safe and welcome in the way that they're entering our service area. So that is something that we do really value and are always looking to educate on and integrate these type of accessible services too.
I think that's so important, the idea of trauma-informed care. For liver patients as a whole, there's so much stigma Coming into a healthcare system, they may assume, rightly or wrongly, that you have substance abuse issues. 75% of liver patients do not. Like sickle cell patients, many liver patients are assumed of drug-seeking behavior when they're just truly in a great deal of pain. And often opioids are safer for us than NSAIDs, ibuprofen, and certainly Tylenol is, above a certain level, is verboten for anybody with a liver transplant. And so there are a lot of issues of the trauma of just having died several times, of the trauma of being a person of color, being disrespected and mistrusted and disbelieved in the healthcare system. I'm on the board of a hospital, and there's sometimes that I go in and I have my trustee badge in my pocket, but I just want to see how they treat me. As a normal person coming into, and I'm, very glad to say that for the 99% of the time at my hospital, it is not an issue. But there are times, and I'm like, am I going to have to reach for this badge? Am I going to? And there has been, a note of recognition sometimes after, an encounter when they start going into my record and it has sort of the VIP access block, and they're like, oh. And I'm like, maybe it would have been a little nicer. But, and so, I think that there's so many different ways, and that's not even going into, patients who have had, actual, assaults or violence or I've had, medical mistakes and things like that. But there are so many different types of trauma that come either from being a person of color or a patient with chronic diseases who has been, interacted with the healthcare system in positive and negative ways, but just for far too long and too frequently, that are not often recognized. And so
Absolutely.
That part of integrating care and recognizing that is so important and so welcomed by patients and patient families.
Yeah, and in our work, when we work with clinicians, we try and bring in a patient, as many as we can, patient advocates, to come and speak to them directly. And many of the clinicians will sit back and say, this was the best of our sessions, because we never get to hear from our patients about feedback so direct. Right. And from a trauma point of view, one time we heard something very interesting where a patient said, there's so many times in an integrated care setting where we're constantly asked to repeat our story. And my story is so difficult for me alone that it should be in my record where I shouldn't have to re-traumatize myself. And that for, when you're a clinician, you're working towards making someone feel better. You're not always cognizant to, asking them about what's wrong or what's affecting you is going to actually have that negative impact. And many of our clinicians walked away really taken back and taken to heart what was told to them. And they said, we're going to be more mindful and find ways in our system to overcome that trauma of reopening the wound of individuals don't want to speak about it with every clinicians that they meet down the line. So talking to our patients, I think, is so important for trauma-informed care, because then we learn how we can adjust the way we speak to each other, the way we integrate our clinicians, and how we navigate.
I have renewed confidence in the healthcare system, knowing that it is in your hands, Katy.
And it's due to your leadership, Donna. Thank you for all these years of mentorship. It really has impacted and changed my life for the better.
Well, what is next? How can I help you as mentor and sponsor and just all around cheerleader for the rest of your career? What is next for you?
Well, I am really excited to recently have my first author publication be highlighted by Linda Dixon with the editor for the Psychiatric Journal. So I think just getting our work is doing across to your patient community, so we can get the feedback from them, is our work to create frameworks to integrate care within these environments. Are they working for our patients, for the liver community, and where can we bring that into their environment? So anywhere you can kind of champion what we're trying to do and give us feedback, we're just so grateful for it, because we just want to keep learning and adapting and growing our work to help everyone out.
Fantastic. Well, we look forward to sending the link to that publication along with the show notes of this. And I thank you for being my guest today. And I thank you for being our very first intern and the model. I hope all of our GLI current interns have listened to this episode so they can see, what it looks like when done well, and hopefully what wonderful things they can do with their futures. We've had, I want to say, 40 some interns since in multiple countries now, that and they've gone on to law school and medical school and public health, and I'm so invested in their careers and success, and just as I'm invested in yours. And it's been so wonderful to hear from you today. Thank you.
Thank you so much.
Okay.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.